Welcome to the video training program of Touch EMR, the fast, simple, and integrated EMR that adapts to you. We're excited to show you everything Touch EMR can do to streamline your practice. So let's get started.
Hey everybody, this is Nitin Chhoda with InTouchEMR.com and InTouchBillerPro.com, and in this video I'll teach you 5 ways to speed up documentation. The problem with documentation is that it takes too long, it's a bit of a pain in the behind, and you honestly want to get through it as quickly as possible. And let's just admit it, that it is what it is. As a clinician, we operate under the general principle: if it's not documented, it's not done. Now the question is, how do you document quickly and minimally, but yet efficiently and in a way that you can be compliant and establish medical necessity so that you get paid, so that God forbid if you ever get audited, you can prove that you can justify what you were doing. So here are 5 ways to speed up documentation. Number 1, voice recognition. InTouchEMR.com and other new EMR softwares allow you to use your voice to document patients. So we've done a separate video training on voice recognition because voice recognition has come a long way. But you can use voice recognition to speed up your documentation. You don't have to type out everything. You can and you should use voice recognition. The second component is what we call automated sentences. Now, there are many schools of thought here, but there's one school of thought where you should type out a few alphabets of the sentence and then the rest of the sentence appears. That's okay, that's not bad. But what I'm referring to when I say automated sentences is a feature where you can take the common phrases that you use. Let's just say you're a physical therapist and one of the common phrases you use is, patient finds it difficult to climb 2 flights of stairs and complains of knee pain, due to knee pain. Patient finds it difficult to climb 2 flights of stairs because of knee pain. You can actually put that in your EMR as a sentence, which is what you can do in InTouchEMR.com, and you can assign that to what's called as a hotkey. So if you're using a Windows computer, a hotkey would be Command 1. So what happens is when you're in a text box, let's say you're in a subjective component of your initial evaluation, you're on your text box in subjective, you press Command 1 and boom, the whole sentence appears. That's what's called as an automated sentence. That can significantly speed up your documentation. The third aspect, as a clinician, have you ever been in a situation where you're documenting subjective and objective? As you're documenting, you think of a goal for the patient, but by the time you get to the plan page, you've forgotten the goal or you've forgotten some of the goals. It's happened to me, it's probably happened to you as well. So within InTouchEMR.com, we have a feature called dynamic goal boxes. You click on the G button next to a question. And by the way, you can create your own questions and templates, and you can click on, you can assign dynamic goal boxes to them. The system opens up what we call a dynamic goal box. You can document the goal there, and that goal automatically appears in the plan page. So essentially, as you're documenting subjective and objective, you have the option to create goals as you're going. Amazing time-saving feature, which is going to make your life significantly easier. The fourth way to speed up your documentation, simple point and click creation of your own templates. The problem with most EMRs is they force you to adapt to them. We adapt to you over at InTouchEMR.com. We allow you to take our templates, which we've built for you. You can change them around completely, or you can build your own templates. In fact, you can even create your own sections in the objective section. You can even create your own template in the subjective section. So you have a lot of flexibility, a lot of customization in the template creation process, which is extremely valuable. And the fifth and the most important component of how you can speed up documentation is when you create a flow sheet, the CPT codes that you enter into the flow sheet automatically update your billing page, automatically reflect on your billing tab. So by the time you get to the billing, in fact, the same applies to plan of care as well. So if you update a CPT code in plan, it automatically appears in billing. By the time you get to the billing page, your ICDs are there, your CPTs are there, your number of units are there. You can enter modifiers if you want. You can enter supporting diagnosis. You click a button and the claim automatically, instantly, completely goes over to your billing software. That significantly streamlines your workflow and makes your practice more efficient so that you can document faster. In fact, using all the 5 strategies that you've learned in this training, you should be able to document faster, you should be able to stay compliant, you should be able to spend more time with your patients so that you can help them and treat them, and not just be a documentation machine and a data entry machine, which is what other EMR systems make you. And most importantly, you can bill faster so that you can get paid faster and minimize denials, which is essentially a function of the billing side of what we do over at intouchbillerpro.com. There are separate videos that we've done on billing and optimum billing. Thank you so much for watching, and we'll see you in the next training.
Thanks for watching this video training from InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We'll see you in the next training module.